Time for Working Together with Rhoda Matthews and Dane Wallace.
Good morning, Dane.
Good morning, Rhoda. Good morning, Flint.
Good morning, Flint, and welcome to Working Together. Dane, when we talk about the assets that the Flint area has to offer, and we often refer to the Whiting, the Flint Children's Museum, the Flint Institute of Arts, our county park systems, and even our highway infrastructure here, but we're going to talk today about another one of those great assets that we have here in the community, and that is Hurley Hospital.
Yeah, the Hurley Medical Center, this is a key part of not only so many people's health care in this community, but also when we look to develop and grow our economy and diversify here, we have that Hurley Medical Center that's right in between the University of Michigan Flint and Kettering University. So it's one more piece of that puzzle of how we revitalize not just downtown Saginaw Street, but the whole core of our community.
And we have a very special guest with us to help us talk about the Hurley Medical Center, Mr. Patrick Wardell, who is the president and CEO of Hurley. Welcome to the show, sir.
Good morning. Thank you very much.
It's our pleasure to have you. Now, not only is August 4th a very crucial mayoral election here in the city of Flint, but voters across the county are going to be able to go to the polls and have their say in whether or not they want to support Hurley Medical Center. Give us some details about this very important vote that's coming up.
Well, first, what we're asking for is 0.9 mil. This would bring in about $10 million. Hurley is a public hospital. We've served the region since our founding 100 years ago. And we're asking the entire county to step up to be supportive, particularly of our safety net services. And those are things like trauma and neonatal intensive care, children's hospital, burn center, and also all the work that we do taking care of people who can't afford. Over 70% of county residents who have no insurance or who are underinsured come to Hurley. We're very proud of that fact. We take good care of them. But it's very expensive, and we're looking for some assistance with that. And we'd like to also grow and strengthen those programs so we can serve the community even better.
Mr. Wardell, I think it's important to remind people that you're a public hospital at the Hurley Medical Center, but for many, many years you actually have not received any funds from the city of Flint. I'm running for mayor here, and it's important that this community does provide some direct support to the medical center. I know I'm personally in favor of the millage. We'll talk more about that. It's part of the ballot. But it's important for a public hospital to have some public support.
Yeah, we're a public hospital. We're municipal. We're owned by the city of Flint. But the city of Flint is one of the many municipalities and townships that we reach out to and take care of. If you have a serious trauma, if you have any of the other issues I mentioned before, sooner or later everyone comes to Hurley either as a patient for one of those things or as a visitor to visit somebody who is afflicted. We're very much a regional resource, and that's why we've decided really to reach out from a funding perspective to all county residents and to be out there and dialogue and debate these issues.
This is a kind of a perfect segue because I want to give you an opportunity to address some of the criticisms that have come up about the millage so you can kind of set the record straight. And one of those is, why should out-county residents support a city hospital that they feel they have no control over?
Well, I think the most important is that when we look at trauma and NICU and so forth, we take care of people from all over. I was just meeting just this morning at the Turi race, which is a fundraiser that we do, with a family from Flushing, the Jackson family, and they had twins. They were told at Ann Arbor that they should have selective reduction, which means they should only carry one baby, and the other should be aborted. And the perinatologist at Hurley saw her 3 times a week. She was in a terrible car accident and had preeclampsia and ended up having to have a C-section early. Her children wouldn't be alive today. if it weren't for the fact that Hurley was right there taking care of them. And those stories are repeated all over. We do not just take care of city residents. We take care of everyone regardless of their ability to pay. And so I think that gives us a special relationship with the entire county, and one that we'd like the county to recognize as we think about how to remain fiscally stable in the next 10 years.
Well, I'll tell you, if there's anybody out there listening to this who hadn't made their mind up about the millage, and that story right there says it all. I mean, the fact that the medical center and the wonderful staff that you have were able to allow a family to have their twins, as God intended, that's a miracle. That's not just medicine.
Right, and I know that when I was pregnant with my daughter, my doctor is actually not a Hurley physician, but even she recommended that I get a Hurley OB because of the great facilities at Hurley. So, when you have folks at other medical institutions who some could deem as quote-unquote competitors, really touting what you have at Hurley, I think that means that we're on the right side in this one.
Yeah, I think each of the hospitals in Genesee County has a different plan, a different vision, mission, and it's recognized that if a sick child is born at one of the other facilities, they're going to come to Hurley. Likewise, we're the only children's hospital. We have 45 pediatric subspecialists, the kind that we as adults are just used to, cardiologists, endocrinologists, and so forth, that practice at Hurley. So if you have a sick child, there's no question about where you need to go if there's anything serious. If it's something minor, you can go elsewhere. But if you're concerned and there's a serious illness, and with kids things can turn serious fast, you need that. So Hurley has that reputation, and it's something that we're very proud of.
I think people would like to hear more, Mr. Wardell, about those positive partnerships that are in place with McLaren and with Genesis, other healthcare providers, because the whole theme of this show is how we work together. Mm-hmm. And I believe that we're going to be a much stronger community. We're going to offer everyone who lives here more opportunities for education, for health, for employment when we work together. So I'm really glad to hear you say that this isn't some way to just make Hurley stronger. It's really something that's going to make health care more accessible and better for people all across this whole region.
Well, one good example of that is the Genesis Hurley Cancer Institute. That's the old St. Joseph's campus. And when Genesis was formed and relocated to Grand Blanc, working with Hurley, the decision was made to leave all the radiation oncology and all the medical oncology services in the city. So that gave an opportunity to reuse that property for something that could bring in jobs and income for the city. We also have a relationship with McLaren around open heart surgery. We do everything short of open heart, but if somebody requires that, our doctors have principal relationships with McLaren, and that's where patients will end up. But I think even more than that, something I'm particularly pleased with is that Hurley has so many students that pass through in the course of a year. Yesterday, I attended the graduation of 6 radiology techs, and it's a 2-year program, 6 or 7 people in each. And I was especially excited that 3 of those 13 students are people who were our members of our housekeeping staff. They had the ability, they had the intelligence, they had the interest. They worked their job while they went to school, and one of them just graduated, and 2 more are going to graduate next year. So Hurley creates this ladder for people to grow into jobs that are more complicated, require more mastery, and we do that not singly, but we do that in partnership with dozens of educational institutions, and each year we have more than 600 students, when I include our residents, who come through Hurley for various kinds of training. Most of those people are local. A lot of them get to stay local, so it provides for stability in our community.
That's wonderful. Now, tell us a little bit about the folks who work at Hurley. Actually, how many employees are at Hurley?